Hello, my name is Inês Nunes da Cunha and I am the FIP Practice Development and Transformation Manager. Welcome to this CPD Bite about the Chronic Disease Services Framework. Before we dive into the main content, let's take a moment to go through the learning objectives of this video. By the end of the session, you should be able to describe the global burden of chronic diseases and their key risk factors. Recognize the critical role that pharmacists can play in the early identification and intervention of chronic diseases. Identify opportunities within your practice to raise awareness and support screening for chronic diseases, particularly among at-risk groups. And finally, understand how to integrate the chronic disease services framework into pharmacy practice. These objectives will guide our journey through the video and help ensure that you come away with practical, applicable knowledge to support your patients. In this video, we will explore the concept of chronic diseases, their global burden and key risk factors. We will also look at the value of pharmacy in tackling non-communicable diseases and the pharmacist's role in chronic diseases management. And finally, and most importantly, I will introduce the Chronic Disease Services Framework, a practical tool to help pharmacy teams deliver structured, impactful care. Chronic diseases or non-communicable diseases, NCDs, are broadly defined as conditions that last 1 year or more and require ongoing medical attention only or limit activities of daily living or both. These multifactorial diseases affect patients from all walks of life and in all parts of the world. Chronic diseases cause the highest disease burden worldwide. Globally, greater than 2 in 5 of all adults are diagnosed with multiple chronic conditions, defined as the presence of more than one chronic diseases. The World Health Organization identified 5 priority NCDs: cancer, cardiovascular diseases such as hypertension, heart failure, and stroke, chronic respiratory diseases such as chronic obstructive pulmonary diseases, COPD, and asthma, diabetes, and also mental diseases. Globally, chronic diseases have become the leading causes of mortality and disability, challenging both population health and healthcare systems. According to the World Health Organization, NCDs were responsible for at least 43 million deaths in 2021, with 18 million people dying from an NCD before the age of 70. NCDs represent a major challenge to the health systems of all countries, with 73% of all NCDs deaths occurring in low and middle income countries. Cardiovascular diseases remain the leading cause of NCD-related mortality, contributing to at least 19 million deaths, followed by cancer with 10 million, chronic respiratory diseases 4 million, and diabetes more than 2 million, including kidney disease deaths linked to diabetes. Collectively, these 4 disease groups accounted for 80% of all premature NCDs deaths. Chronic diseases are caused by a combination of genetic, physiological, environmental, and behavioral factors. This slide highlights the most common behavioral and metabolic risk factors that increase the risk of chronic diseases. Major modifiable risk factors for NCDs include tobacco use, physical inactivity, alcohol use, unhealthy diets, and air pollution. Prevention and management of chronic diseases is dependent on reducing underlying risk factors. Monitoring patient risk factors can also help support early identification of chronic diseases. Pharmacy and pharmacists play a vital role in the global fight against chronic diseases. There are multiple touch points that provide the opportunity for pharmacy team members to impact patient care. For example, routine pharmacy services may reveal patient risk factors for chronic diseases or existing chronic disease symptoms, making them ideal touch points for further patient counseling and referral. Also, pharmacists can provide initial counseling on what a specific chronic disease is, the risks a patient may have of developing a disease, why it is important to get tested, how they can get screened, and what symptoms to monitor for. According to the WHO, detection, screening, and treatment of NCDs as well as palliative care are key components of chronic diseases management. Although the extent of the involvement of pharmacists in chronic diseases care may vary depending on the country in which they practice, community pharmacists are well positioned to deliver many early identification and timely interventions measures and refer to primary care when appropriate. To support pharmacists in managing chronic diseases, the Chronic Disease Services Framework has been developed to help community pharmacy teams initiate meaningful conversations with patients and make every moment count. The Chronic Disease Services Framework has been designed to enhance patient interactions and minimize the burden on workload and workflow in community pharmacies. This framework supports community pharmacy teams in effectively identifying patients at chronic disease risk and providing motivational counseling to empower those who will benefit from chronic disease assessment and management. You can access the Chronic Disease Services Framework via the FIP-NCD's microsite. Simply go to the main NCD areas, select Chronic Disease Care, and then click on Toolkit. The Chronic Disease Services Framework is a cross-therapeutic approach to chronic disease care within the pharmacy. The Services Framework is an opportunity for pharmacy to play a meaningful role in the management of chronic disease by enhancing the quality of patient interactions, optimizing collaboration with primary care, and ultimately improving the health of their community. The framework consists of two key components. First, the Chronic Disease Services Initiation Toolkit, and then you have the various chronic disease state pharmacy toolkits, such as the Chronic Kidney Disease Pharmacy Toolkit, the Heart Failure Pharmacy Toolkit, and the COPD Pharmacy Toolkit. In addition to this, we plan to introduce the Hypertension Pharmacy Toolkit later this year. The Initiation Toolkit was designed to motivate and support community pharmacy teams to establish or enhance a community-based chronic disease screening and management program. The Initiation Toolkit has 4 core elements that aim to upskill pharmacy teams in the value of a standardized approach to chronic disease and to operationalize this program in the pharmacy, collaborate with prescribers, and promote such services to their patients. The fourth element is the Chronic Disease Services e-learning module. This e-learning module introduces the Initiation Toolkit and disease-specific pharmacy toolkit elements and describes how to integrate those elements into everyday pharmacy practice. The second is the Chronic Disease Services Implementation Checklist. That is an operational tool summarizing key considerations for initiating or expanding chronic disease services and guiding effective integration into a daily workflow. The Chronic Disease Services Promotion poster is a print-on-demand poster that informs patients to initiate a conversation with the pharmacist or pharmacy team member about their chronic disease risk and or current chronic diseases. And finally, we have the Chronic Disease Prescriber Services Promotion Letter. This is a print-on-demand letter addressed and sent to a local prescriber outlining pharmacy-based chronic disease services and how partnership can enhance community health. I will now provide a more detailed overview of each element within the Initiation Toolkit. So, the Chronic Disease Care e-learning module is a study module that we recommend to be completed by all pharmacy staff who will be participating and helping to deliver the chronic disease services program. This module is designed to highlight the accessibility and value of pharmacists in chronic disease management and establish why a standardized, streamlined approach to chronic disease can maximize patients' interactions. In this module, you will find several chapters with content to help you better understand chronic diseases, the role of pharmacists in chronic diseases, and what is the chronic diseases framework. You will also find the module Key Learning and the glossary of terms. The Service Implementation Checklist is an operational tool designed for pharmacy decision makers such as managers and owners. It serves as a self-evaluation or audit tool to help prepare for starting or expanding chronic disease services effectively, offering a straightforward guide to set your team up for success. The checklist outlines key considerations and strategic steps to review when planning a pharmacy-led chronic disease management services. It is not exhaustive but provides a practical and easy-to-use guide to help your team offer a sustainable and impactful services. The checklist covers important areas such as staffing, physical space, technology and tools, operations and workflow, services sustainability, demand and promotion, as well as collaboration and referral. The chronic disease promotion poster begins with a provocative question for patients. Are you living with a chronic condition? And did you know that every 2 seconds a person dies prematurely from a chronic disease? The poster invites patients diagnosed with a chronic condition to speak with their pharmacist or a pharmacy team member. It also explains how the pharmacies can support them in managing their condition. A pharmacy team member should print the poster and display it in a highly visible spot for patients to see and act on the message. The poster helps the pharmacy use in-store marketing to inform all visitors about the benefits of chronic disease services provided by their trusted pharmacists. This simple tool takes less than 3 minutes to print and display. The prescriber services promotion letter is a referral letter sent to the patient's primary care physician. It explains the purpose and benefits of the chronic disease services for shared patients and highlights the pharmacy team's goal to improve collaborative community health care, including potential referrals to the prescriber. The pharmacy manager or owner personalizes the letter by adding their name and pharmacy details. It can be printed and mailed or saved as a PDF and emailed to the prescriber. This letter is designed to build collaboration with local prescribers and clarify expectations around pharmacy-based chronic disease services. And completing this letter should take less than 3 minutes. Also, an infographic was developed as a one-page digital visual aid to complement the chronic disease pharmacy toolkit. It provides a quick reference guide on where, when, and why to use the toolkit in pharmacy practice. The infographic also includes quick links to key resources, making it easy for pharmacists to access and apply the tools. As I mentioned earlier, the Chronic Disease Services Framework has 2 components: the Chronic Disease Services Initiation Toolkit and the Chronic Disease State Pharmacy Toolkits. So far, we have 3 chronic disease toolkits: the CKD, the heart failure, and COPD toolkits. All of these toolkits are also available on the FIP and CD's microsite. Each of these toolkits also consists of several elements, but in general, for each disease, you will find one disease state e-learning module customized to a specific disease state, a disease state assessment tool developed to be used by pharmacists and pharmacy team members to support patient counseling about the risk of a disease, the condition itself, how patients can be screened, and how the disease can be managed. A patient information leaflet. This leaflet summarizes important information for patients, such as what the chronic disease is and how it left undertreated, that there can be serious complications in the future. And finally, you will find a primary care referral letter. That is a document that simplifies documentation and the referral process. The referral letter explains why your pharmacy is contacting the physician and how you can work together to support the patients. These resources in the Chronic Disease Services Framework can be used alone or in combination to support the initiation, expansion, and or delivery of pharmacy-based chronic disease services. In summary, this framework will help you to recognize and identify patients at risk of chronic diseases or with chronic diseases symptoms, to start a conversation and take action, and also to collaborate with primary care. By combining FIP resources with the Chronic Disease Services Framework, community pharmacists can be better supported in delivering effective chronic disease care. In conclusion, pharmacists, as accessible primary healthcare providers, are ideally positioned to support better management and outcomes for patients with chronic diseases. There are multiple touchpoints within the pharmacy for at-risk screening and symptom management interventions. FIP offers many resources on non-communicable diseases accessible through the library on the FIP website or via the NCD's microsite. And I invite you to explore these resources and consider how they can support your daily practice in the prevention, screening, and management of chronic diseases. I hope this video has helped you better understand the Chronic Disease Services Framework and how it can support your practice. Thank you for watching.